Hi, I'm Dr. Chad Ramahan, Medical Director of the Chest Pain Center at El Camino Hospital. What you've just seen is a simulation of a patient having a heart attack. While you may have seen footage like this on TV or in the movies, what you have not seen is the process that begins behind the scenes when the patient calls 911. That's because the treatment of heart attacks has changed dramatically in the last few years. Centers like ours have a highly specialized team set up to assess and treat patients with heart attacks very quickly to abort the heart attack in ideally less than 1 hour. Here's how it happens. After placing that crucial 911 call, the fire department or the emergency medical technicians will arrive on the scene within minutes. Paramedics will take an immediate assessment and EKG on the scene to assess if the patient's having a heart attack. A recent innovation launched just this year, known as LifeNet, will transmit the patient's EKG from the field to the El Camino Hospital emergency room, which will be immediately read by an emergency physician, and if a serious heart attack is suspected, the cardiac team and interventional cardiologist will be paged to come to the hospital sometimes before the patient, saving precious time. While the patient is en route to the emergency room, I, as the on-call interventional cardiologist, will view the EKG images from wherever I happen to be. At the hospital, on the road, at home, or in my office. I can even use my smartphone to see them. Within less than 15 minutes of that initial 911 call, the patient will have arrived at our hospital, where emergency staff will be waiting at the door, ready to assess and treat the patient. Within 30 minutes after the 911 call, the patient will have been transferred to the cath lab, where a room has already been set up and prepared for the patient's arrival. In the cardiac cath lab, we'll treat the patient by performing an emergency angioplasty. We'll insert a small plastic tube called a catheter and thread it from the groin up into the patient's coronary arteries. This will restore blood flow to the heart muscle and abort the heart attack. From start to finish, the time to treatment is less than 1 hour. How is that possible? The main reason is that our hospital is a nationally accredited chest pain center, which means we exceed all national guidelines and standards for the treatment of heart attack. Our program starts with the ambulance, goes through the emergency room, involves the cardiac catheterization lab, all the way through cardiac rehabilitation. And why is time so important? Because time is tissue. If you're having a heart attack, the quicker you get treated and blood flow restored, the more tissue is saved. This translates to improved patient outcomes, improved quality of life, and less mortality. So when it comes to heart attacks, our message is clear. Don't wait, call 911, get to an accredited chest pain center like ours. Our team will be ready and waiting for you.